Getting diagnosed with an autoimmune disease changed my life, but not in the way that you might expect. After years of unexplained pain and fatigue, I finally got an answer: psoriatic arthritis. In August of 2024, I was diagnosed with psoriatic arthritis. It's an autoimmune disease and it's a type of inflammatory arthritis. And honestly, this diagnosis was such a huge relief that it felt like I had been holding my breath for years and finally I could let it out. Like, I still was in pain and I still had a lot of symptoms, but finally I had a diagnosis. I had finally found a doctor who believed me. I finally knew what was going on with my body. I had a deeper understanding of my body and myself. Getting the diagnosis just brought me so much peace to know what was going on, and just, I think mentally I started feeling better because I knew what was going on and had my diagnosis. I want to make this video today just to sort of explain the process of getting diagnosed, what my symptoms were, how I'm feeling now, and just kind of like talk about everything, because one of the first things I did after getting my diagnosis was run to YouTube and try to find other people with psoriatic arthritis. And to be honest, I was kind of disappointed. Overall, there wasn't a lot of videos, especially with people telling their own experience and story with psoriatic arthritis. And so I just want to make this video in case somebody else goes to YouTube after getting a diagnosis and wants to feel a little bit less alone. So I want to make this video today to talk about things from my perspective. I'm in my early 30s now. My symptoms really sort of increased a lot in my late 20s. But I already had symptoms in my early 20s, and I think even going back all the way to childhood, I had a lot of unexplained pains when I was a kid that the doctors really, couldn't explain and kind of brushed off. And I see a lot of connections between those pains and what I was experiencing in my 20s that was then diagnosed as psoriatic arthritis. Symptoms for basically my whole life, many, many years, but especially the last 10 years, I've had a lot of symptoms, a lot of pain. One of the pains I had as a child that was kind of unexplained was at the front of my body. I felt like it was sort of like a tendon or maybe the front of my hip. It often felt like there was just like a knife stabbing me, and then I would feel a pop and I could go back to walking or something. And doctors always said that this was growing pains, but I don't think it was, and failed to get any explanations back then. And then in my early 20s, the pain sort of shifted from the front and rather towards the back. So sort of my lower back or hip area would get a lot of pain. Sometimes I would wake up in the mornings and I couldn't walk, and then after an hour or two, the pain would subside and then I could walk. Over the years, this pain would increase in frequency. So instead of happening just like once a year, maybe a few times per year, and then also the amount of time that the pain would stay before fading away also would get longer and longer. I also started experiencing a lot of neck and shoulder pain. I thought that I was just sort of sleeping poorly and tried different pillows or different mattresses over many years, and nothing ever really helped. So I just always had these like shoulder and neck aches and pains. It wasn't a sharp pain or anything severe, but it was just like I always had sore bones in my shoulders and neck area. A lot of these pains, like the neck and shoulder stuff, I just sort of thought like, okay, I'm getting older. Everyone always says you get aches and pains as you get older, so maybe this is just, what aging is like. Every time I went to a doctor or tried to talk to the doctor about my low back pain where I couldn't walk, they always just asked how often it happens, and since it wasn't something that was happening extremely frequently, they always just brushed it off. The big turning point in my symptoms was 3 years ago. I woke up and my left elbow felt a little weird, and I thought, okay, I just slept wrong, it'll go away during the course of the day or something. But then after a few days, the elbow was still feeling off. It wasn't a sharp pain or anything, it just felt a little funny. And then I went to a doctor. I live in Germany, so I went to a house arts or like a general practitioner, and they examined my elbow and said come back in a week if it still feels weird, but from their point of view, they didn't see anything weird with it. And after I went back and still had the problem with my elbow, I got referred to see an orthopedic doctor who also advised me just to wait. Eventually, after enough waiting and I still was having problems, he ordered some MRIs of my neck and shoulders because he thought maybe the elbow pain was coming from there. The only thing he confirmed was that it's not, and then after that, there wasn't much else that he was willing to do for me. At this time, the pain in my elbow was increasing. So at first it just sort of felt weird, and then it was getting worse and worse from like really, really sharp pain, sort of like inside the elbow. At one point for about 6 months in the beginning, I could not even like hold a glass of water in my hand, in my left elbow, because the pain was too sharp here inside the elbow. And then I also was getting pain, I guess a tendon going down the elbow, and then I would get a lot of like dull aches up here. So it was kind of really just like spreading out into the entire arm here. That was 3 years ago when I woke up with the pain in the elbow. And if you can see now, I still can't fully stretch out the elbow. It doesn't lay completely straight the way my right arm does. This is so much better than what it was. The last 3 years, this first 6 months, I had sharp pain, and then it sort of like eased from a sharp pain into this dull ache and just the inability to fully use the arm. So I couldn't stretch it out more than about this for 3 years until I got my diagnosis. And now, being on medication for over 6 months now, the range of motion in my elbow and my left arm is greatly improved, and I am so happy about that. So I had, the pain in my hips was increasing over the years, the pain in my elbow for 3 years, and I was trying to see different doctors, and nobody was really helping me much or investigating things properly. Like, I felt really unheard, like no one was giving me the proper care and attention that I was needing. I was having so many spells where I couldn't really walk or exercise because of the pain from my lower back. I was just having to lay in bed for days on end, and then anytime I tried to exercise, or I'm a huge fan of hiking, so I would go on a longer walk. Nothing extreme, but just like, go for a walk in a forest for an hour or two. And then I always felt like I was being punished for moving my body, because then my physical pain would be so much more. Everything came to a head last summer. I woke up at the beginning of July with a weird feeling in my knee, and I immediately was like, oh, this is the same thing as what happened to my elbow. So my knee was feeling funny for a few days, and then my knee started to get swollen, and I could barely walk on it at all. And so I would have to rest for days on end and then try to walk. And anytime I tried to move, the knee would get swollen again. So as I've been referencing, it was really hard for me to get the proper medical care that I needed, and took years and years to get a diagnosis. I think here in Germany, to try and get answers for this, I've seen over 7 different doctors, trying to explain to them my pain, and a lot of them didn't really pay attention or ran a few tests, but didn't want to be investigating further to really try to figure out what happened. And at this point, I had gone to, I think, my 3rd orthopedic doctor, and this guy was really good. And he was truly amazing from the very first visit. I felt really, really listened to all of my symptoms and explained things to me. All of my questions, he didn't have a problem answering them, whereas other doctors wouldn't answer my questions. And some of these other previous doctors I had visited, I literally left these appointments in tears, just because they were honestly quite dismissive of me, and I was just in pain and not getting the help that I needed. But finally I found this good orthopedic guy. After examining my elbow and talking to me, he was really shocked at the medical care that I had received so far. He decided to run a few basic tests, such as getting an x-ray of my elbow. He was really surprised that nobody had ever done that before, especially after having pain for years at that point. And so I was really thankful that I found him, and he was running these basic tests. And I originally went for the elbow, and we were sort of investigating that when everything with my knee started to happen. And at that point, he was really like, all right, like, we've run some tests with the elbows, and I think he had some suspicions of his own. And then at that point, he referred me to see a rheumatologist. But even now that I had a referral to go see a rheumatologist, it was really hard for me to get an appointment at a rheumatologist. I contacted, I think, over 20 different practices. A lot of them weren't taking new patients. And then I finally got to my appointment, and one of the, like every time you see a new doctor, you have to fill out some different questionnaires. A lot of different questions about like how my body was feeling, but they also had a questionnaire about the process of getting an appointment. To fill out like how many places I contacted, how long it took till I got an appointment. And I think that just shows that they're aware it's difficult to get an appointment. So I'm glad somebody's tracking that data, and I don't know what they're gonna do with it, but these people are aware it's a problem. To get my diagnosis, it just took years of going through bad experiences with different doctors, switching doctors, getting referrals to different doctors, doing different tests. I've done multiple MRIs, etc. And just really having to advocate for myself because the doctors were so dismissive and not really keen to investigate the problem that I was having, because I was presenting, an elbow problem and a hip problem for years. The doctors would say, okay, first we have to solve one of these problems first, and then we can go to solve the next joint pain. And I really had a feeling that it was all connected. I later learned that because of the health insurances, at least on public health insurance in Germany, that they couldn't treat both problems at the same time, which seems really weird. And yeah, when I finally got to see the rheumatologist, like I said, it was amazing because finally somebody was looking at all of the symptoms in my body as a whole instead of just focusing on one symptom and trying to solve that. Like, she was looking at all of the symptoms. Initial appointment with my rheumatologist was about 30 minutes. She had a lot of questions for me about different pains I've had, when they started, what they feel like, any changes. She had a lot of questions about my family medical history, which luckily I had prepared all of that. Any sort of medical issue I have now or experienced in the past, she wanted to hear it. She took notes on it. So I really felt like somebody was finally paying attention on my diagnosis that day. I thought maybe that as a new patient with her, like, she would talk to me, get to know me, ask questions, and then I'd have to do follow-up exams, etc. But luckily, all I had to do was a blood test. And then after talking to me, she was able to diagnose me with psoriatic arthritis, which is connected to psoriasis. So I have psoriasis on the back of my scalp. I've had that since I was a teenager. I think I read somewhere that it's about like 10% of people who have psoriasis also end up developing psoriatic arthritis. Getting this diagnosis was kind of hard. Like I said at the beginning of this video, it was such a relief just to finally get a diagnosis and finally know what was going on, because it had been increasing the amount of pain, but the last years, especially since the elbow, the last like 3 years were really, really bad. I could barely exercise, I could barely move, I gained a lot of weight, just really wasn't feeling like myself physically and mentally. The struggle to get a diagnosis was really hard because the physical pain was taking its toll on me, but it was also really affecting me mentally because I just had a lot of fatigue. And then when I was in so much pain every day, it was really hard for me to just do anything. And then to see a doctor and feel really dismissed and not getting the answers that I was needing, was really difficult. And I started to gaslight myself into thinking there's not actually anything wrong with me. I'm just lazy and dramatic, and the pain I feel is just regular pain or regular aches and pains of getting older, and I should just handle it better. Everybody experiences this, therefore, why am I making a big deal out of it? And I should just, be stronger. To get the diagnosis and know, okay, no, there actually was a problem. You actually do have a disease. You're actually experiencing things that most people don't experience. Yeah, there is something going on, and I am valid for feeling this pain and feeling fatigued, and all of the other symptoms I have was affecting my mental health. Like I said, I was just depressed and not wanting to see people. I was canceling so many plans the last years because I was in too much physical pain to go, across the city to see some friends or something. So socially isolating myself more and more. I also feel like that it impacted my brain. A lot of mental fog, I guess. Intellectual tasks where I really needed to think deeply, I just felt incapable of doing. My brain just wasn't functioning the way that it used to, and it was really frustrating because I'm not sure if that's just mental fog from having an autoimmune disease or just an impact from having poor mental health, which was brought on from this autoimmune disease. A lot of things in my life got put on pause the last years. I honestly feel like the last years I was just in complete survival mode. I was not living life, I was not thriving, I was just completely surviving and just could only do the bare minimum in terms of physical activities, mental activities, doing things just in general, just the bare minimum, and that was a huge challenge just to do the bare minimum, and anything more was just impossibly difficult to think of or to do. And after I got my diagnosis, I immediately started different medications. I think I've been on 5 or 6 different medications now, and right now I'm on Humira, and I have my next appointment with my rheumatologist at the end of this month, so in a few weeks, and she'll see how I'm doing. Honestly, with Humira, I'm feeling the best out of all the medicines that I've tried so far. Like I said, things are getting better with my elbow. My knee's also getting better. I still have pain in both. My knee's also still swollen. There's still swelling in my elbow here. But other pains, I still have neck pain, but it's better. I had a lot of pain in my thumb here, and that is mostly gone. My hip pain is also pretty much gone, which is so nice. I'm able to use my body more, I'm going back to the gym again. I live in a big city, I live in Berlin, and I'm able to take the public transportation across the city to do different things. And all of that was just such a huge hurdle the last years. So it's really nice for me to be able to sort of slowly start to heal, slowly start to get better, and slowly begin to feel like myself again. I also started therapy after my diagnosis. When I got my diagnosis, my doctor, my rheumatologist, she gave me a bunch of pamphlets giving me information about the disease, teaching me all about psoriatic arthritis. And one of the pamphlets was it's really good to get therapy with autoimmune diseases. There is a lot of connection between the mind and the body, and I think getting therapy has been really helpful for me. And I also read the book When the Body Says No, I think is the name, by Gabor Maté, which was really an incredible book that I really recommend reading if you haven't read it yet. Getting my diagnosis was just a relief to know what was going on, but at the same time it was really hard because on some level I was always hoping that there would be a quick and easy explanation, that it would just be oh, take this medicine for 3 weeks and it'll solve everything. Or worst case scenario, we have to do a surgery, but then this surgery will solve everything. To get this diagnosis of having an autoimmune disease, a chronic illness that's going to be with me for the rest of my life, was kind of oh wow, it's really serious and it's going to stay with me. I knew something was wrong, but yeah, to know that it's with me for the rest of my life has been sort of difficult to wrap my mind around. After having my life just on pause for 3+ years, I finally feel I'm gaining my power, feeling like myself again, and starting to move forward again with things. Yeah, that's basically my story of my diagnosis, my symptoms. If there's anything that I missed and you would like to know, let me know in the comments. I can make some follow-up videos or answer them in the comments. And if you found this video helpful at all, please leave a comment to let me know. Or if you have psoriatic arthritis or any other sort of autoimmune disease, let me know. It's really nice to connect with other people who have autoimmune diseases. In the description box, I'm going to leave some links to some of the other videos I found where people were talking about psoriatic arthritis. And yeah, thank you so much for watching this video. Ciao!